Hey guys, and welcome to the presentation today. The presentation is concerning HIV PrEP medication. So what is PrEP medication? It is a medication that is used to prevent the spread of HIV. So who is at risk for HIV? That is men having sex with men, people who are using used needles to inject medications or drugs, using recreational drugs, and people who are of age of 16 to 24 due to increased sexual activity. Indication. So who would use the medication? And that would be people without HIV who are very high risk from getting HIV from either sex or injectable medications, people who are in an ongoing sexual relationship with somebody who is known to be HIV positive, and it is used in people who are not mutually monogamous or having the same partner every time they have sex, gay or bisexual men who has had anal sex without a condom or have had a sexually transmitted disease in the last 6 months. So how does it work? Well, it strengthens the T cells, which usually go and attack the virus that is sent into our bodies. So it strengthens up those T cells to help fight off the invasion of the HIV virus. So it's kind of like building a barrier, building a wall. So if we had a fort, that would be our security. So the medication is kind of like our security. It prevents things from getting into our body, into our system that we do not want. And by doing this, by taking this medication, it reduces the risk of HIV by 90% from having sex, and that would be even higher rate if you use a condom. It also reduces the risk of HIV by 70% if you're injecting medications into the bloodstream with used needles. So how is it administered? It needs to be taken by mouth every day. If you miss a dose, it is important to take it as soon as possible, as soon as you remember. But with that being said, you do not need to double up on doses because that can cause increased nausea. So the best thing to do is to set a timer, use your calendar. I know at this age you're probably not going to use any pill containers, but set something up on your cell phone, a reminder every day at the same time, whatever works for you, whether it's morning or night. Because if you do not take it every day, it's not as effective. So again, going back to our security of the body, if you have a fort, you want to make sure that your security guards are there every day. So therefore, you need to take the medicine every day so that it can be the security for your body. So what are some side effects? Some side effects are, most commonly, is nausea, but that will subside over time. Other side effects are or diarrhea and vomiting, headache, and lack of energy. There has not been any significant long-term side effects in usage of over 5 years' time. So the most common thing is, like I said, nausea, but that does subside over time. So what kind of monitoring do you have to have if you're on this medication? Well, first and foremost, before you put on the medication, you have to have a negative HIV test before they will even initiate the medication. Then you have to be tested every 3 months and have a negative test in order to get another prescription. So your physician is not going to give you but a 3-month supply in order for you to come back, get tested, and then you get another prescription. Some other lab values that will be done will be a CD4 count, and that will make sure that it is working effectively, and that will be well above the threshold, which will consistently range between 300 to 500 cells or higher. Just so you know, so whenever you have your blood drawn, you can ask your provider, what is my value? So, at this point in time, I would like to know if there's any questions. Since there are not any questions, thank you for coming to this presentation today. I look forward to working with you again.